everyone, to the final pitch event of the 2020-2021 Innovation Catalyst Strategic Realignment. Tonight, we're going to hear from our 5 impact teams on the progress they've made on their various new business models, strategic realignment plans, and creative alternative revenue streams. We're excited to have you all here tonight to hear from these 5 rock stars, as well as celebrate the conclusion of a 7-month intensive coaching and consulting process. Since 2013, C&M has partnered with CauseImpact. CauseImpact is a social enterprise and nonprofit consulting firm based in Columbus, Ohio. They bring social entrepreneurship and strategic revenue development to Nashville nonprofits through the Innovation Catalyst program. Now, I've got to tell you, this program is truly one of my favorite things that we do at C&M. We are so honored to have Sean McGee and his talented cadre of consultants, Joy Bronson, Tom Bishop, and Matt Lewis, work with many of our members through the Innovation Catalyst and also with business planning and other consulting. I'm excited to rejoin this 2020-2021 cohort of impact teams to learn and celebrate the progress that we've made since our midterm event in early December. We couldn't do this without our funders, and so I want to say thank you to the Frist Foundation, LBMC, Google Fiber, and Alliance Bernstein. And tonight, we're very excited to bring you, for the first time ever, a People's Choice Award. This will be a cash prize awarded to the impact team that receives the most votes. And guess what? There's still time left to secure a vote. So if you'll follow the link in the YouTube comments to make a minimum $10 donation, you get to vote. At the conclusion of our final presentation tonight, all donors are going to receive an email with a link to vote for one of the 5 ICAT organizations. The winning organization will be revealed tonight, and they'll receive 100% of the donations received, plus C&M is going to match dollar for dollar up to $1,000. So if we get $1,000 of $10 donations, that's going to be $2,000 for that lucky impact team. So make sure you donate, share the link, share with your friends, boards, and others to increase the prize for the People's Choice Award. And now I'm really happy to introduce Joy Bronson of CauseImpact.
Hi everyone, my name is Joy Bronson. I am an associate with CauseImpact. I want to say again, thank you and welcome joining us this evening from our homes or wherever we are located. As Sean often jokes with the teams, we hope that you know where the restrooms are because we don't know where your restrooms are. And we just want to give quick background for the folks who are watching on what the ICAT or the Innovation Catalyst is, in case you don't have any familiarity and haven't heard all the ins and outs for the folks on whose behalf you may be watching. So the Innovation Catalyst or the ICAT supports teams in their developing social enterprise concepts from concepts to well-researched business models, typically over a 9-month period. This particular cohort has had the unique gift and opportunity, pressure might help some folks out in a way of having had to do this in about 6 months. So they did the catalyst with the bigger catalyst of our being in COVID-19 at this time, and a lot of this being online. So we're looking greatly forward to hearing how things have developed from what for a lot of folks were brilliant concepts into what are even more brilliant business plans and ideas for how all of our organizations are taking themselves forward into next. And so we think it's very important to stress that CauseImpact is not developing these concepts for our organizations. We are walking with them and journeying with them really in many ways in the next evolution of their greatness. We've had the opportunity to partner with some amazing folks since launching this initiative in 2013. So we have had 37 participants of our 7 cohorts here in Nashville and 25 organizational participants in our cohorts in Columbus, for a total of 62 since 2013. And 70% of those participants have launched or are preparing to launch their programs. For folks in Nashville, you may be familiar with organizations such as Insight Counseling Center, Cable Foundation, Project Return, Tennessee Voices for Children, 50 Forward, and Nashville Food Project, just to name a few of the excellent and amazing organizations with whom we've had the opportunity to partner. And this evening, we are looking forward to the brilliant organizations with whom we've had the opportunity to partner and journey over these past several months. So thank you for joining us. Please stay tuned in to hear some amazing presentations, and let's all have a great night.
Thank you, Joy. Well, we are so honored tonight and excited to have investor, innovator, and entrepreneur Marcus Whitney kick off our special event. Marcus is the founding partner of Jumpstart Health Investors, the most active venture capital firm in the nation, and he recently launched Jumpstart Nova, the first Black healthcare venture firm in America. Marcus helped bring professional soccer to Nashville. He's a co-founder and minority owner in the Nashville Soccer Club. And he's been featured in many publications, national publications, for his business savvy and impact. He's also the best-selling author of a book called Create and Orchestrate. It's about claiming your creative power through entrepreneurship. And you're all going to want to go find his podcast, the Creative Power Podcast. You can find it wherever you get your podcasts. Mostly, I just want to say that Marcus cares very deeply about this community, about social entrepreneurial endeavors. He serves on lots of nonprofit boards. I can't think of anyone better to rev us up for tonight's friendly competition. So Marcus, thank you, welcome, and let's hear from you.
Terry, thank you so much. I'm really honored to be here, and everyone did not sign on to hear me. They signed on to hear these incredible pitches today. But I do want to just encourage and definitely give a big shout out to all of the folks that are pitching today. What you're doing is so incredibly important right now. The intersection of causes in the world and solving those causes sustainably through entrepreneurship. We are really just at the beginning of a massive wave of these kinds of solutions. And now is really the time for people to go through projects like what CNM and CauseImpact have created here, to train, to wrap their minds around the entrepreneurial mindset, and to step out from simply doing grant writing and getting to the pitching game and get into the how do I make this sustainable game. On Wednesday, I had the honor of participating in a roundtable with the executive director of UNICEF, Henrietta Fore, who is an absolutely charming, brilliant woman, and is currently through UNICEF with all of the incredible people who are working at that organization, partnered with the World Health Organization and several other organizations on an initiative called COVAX, which is, I believe, the largest global vaccine program in the history of mankind. And obviously this is a really big deal. We've had, lots of vaccines that have been deployed across the United States and certain parts of Europe and Asia, but there are many countries that are behind, and UNICEF and the World Health Organization are really driving this. And so over the course of an hour, we were listening to her, we were learning, we were, understanding more about the program and about, what UNICEF looks like in the 2020s in general, and came upon a portion of the conversation where we sort of were able to ask, hey, how can we help? And one of the most important asks that she made was connect us to entrepreneurs, connect us to social entrepreneurs, connect us to innovators. And there's just this sense that whether we're talking about, right here in our backyard in Nashville or on the global stage, we now realize we have to bring entrepreneurs with all of the power that they bring, all of the innovative thinking that they bring into this solution making process, and we have to include them and mix sustainability and entrepreneurship in with philanthropy. And so nothing could be more exciting for me than to wrap up here and just say best of luck to all of the teams today in your pitch. And hopefully this is the first of many times that we get to hear from you all. This is really, really exciting for me. And Terry, thank you so much for having me.
Thanks, Marcus. That is really, really interesting. And I'm excited to think about how Nashville entrepreneurs can do the same thing as the COVAX group needs as well. So thank you so much for getting our juices flowing and getting us inspired, and for being with us today. And that makes me excited to hear from all of our impact teams. At this time, I'd like to turn it over to Sean McGee, who is the principal of CauseImpact and the lead consultant. Okay, and I realize I'm not on video. The lead consultant of Innovation Catalyst. So to get this started, Sean, tell us what we're going to do. Sean, you're muted. You're muted, Sean.
Well, you knew that was going to happen.
Well, I didn't have my video on, so you get a pass.
So thank you, Terry. I'd like to take this opportunity to thank you and the staff at CNM, especially Megan O'Rourke, Kyla Phillips, and Marissa Sweiston. You've been such great partners for the last 8 years, through thick, through thin, and through COVID. We're looking forward to working together for many years to come. I also want to thank my colleagues at CauseImpact, Joy Bronson, Matt Lewis, and Tom Bishop for all their hard work on this year's Catalyst cohort and on tonight's event. And of course, I want to thank our panelists tonight. This evening, we're going to see 5 nonprofit organizations pitch their social impact business plans to a group of funders and business experts. These talented panelists will ask questions and provide feedback and help all of us to better understand the ideas that our presenters are pitching. So please join me in welcoming Harry Allen from Studio Bank, Robert Abinger from Bernstein, Jake Martino from Bridgestone, Chad Millam from LBMC, and Darshan Prabhu from Star Investment Holdings. Thank you all for coming and helping us out tonight. We're really looking forward to hearing your expertise and wisdom. And now it's time for our teams to share their vision and their plans. For those of you in the audience on YouTube live stream, please be generous with your applause and encouragement in the comments. YouTube has an endless supply of emoji. So, without further ado, I'd like to introduce Amna Osman from Nashville Cares. Amna?
Good afternoon. Thank you for the opportunity to present our project today. My name is Amna Osman. Nashville Cares has been serving Middle Tennessee with dignity and respect for more than 35 years. We serve more than 50,000 individuals living with or at risk of HIV, providing comprehensive services with the goal of providing seamless access to care and alleviating barriers. Our mission is to end the HIV epidemic in Middle Tennessee. We work to achieve this through education, advocacy, and support for those at risk or living with HIV. Our vision is a community where infections are rare, and when they do occur, everyone with HIV has access to care, treatment, and support to achieve optimal health and self-sufficiency without stigma or discrimination. The Tennessee Department of Health epidemiological data states that 5,300 people in the metropolitan area are living with HIV. 1 in 7 are not aware of their HIV status. 1 in 7. Nearly 1,200 people are not receiving HIV care, and nearly 2,200 people are not retained in care. A staggering statistic is that 2,800 people have an unsuppressed viral load, meaning they can pass the virus to others. We know that social determinants impact linkage to care. These include poverty, lack of transportation, education, and housing. Stigma and racism affects people living with HIV, and the face of HIV has changed, with HIV disproportionately affecting communities of color, especially the Black community. We take pride of the reputation and experience of our staff and our connections with more than half of the 5,300 people living with HIV. Our solution is to build on our connections and experience by opening up a pharmacy specializing in HIV medications where we can provide seamless, convenient, and efficient service delivery by knowledgeable and caring staff. So now let me share a story about one of the 1 in 7, Kayla. She came through our drive-through testing event last month and her suspicions were confirmed. She tested positive for HIV. Within minutes of her test result, a trained Nashville Cares specialist met with her to discuss the results and next steps. Our specialist made an appointment and accompanied her to our Nashville Cares My House clinic to have a confirmation test. Our nurse practitioner explained the importance of starting treatment right away and gave her a prescription along with a 7-day supply of medication to take in the interim. With the addition of a Cares pharmacy, Kayla would have been able to get her prescriptions filled immediately by caring, knowledgeable HIV staff. No waiting, no stigma, a complete and efficient linkage to care. The Cares Pharmacy will be reinvesting all profits directly into the programs and services Nashville Cares provides to clients, which include medical and supportive services. This additional funding will increase awareness and adherence and increase our impact to ending the HIV epidemic. When a person living with HIV is adhering to an effective treatment regimen, levels can become undetectable, which protects their health and makes them incapable of transmitting HIV to their partners, or what we call U equals U. Undetectable equals untransmittable. What sets us apart from other pharmacies is our HIV expertise, our comprehensive approach to service delivery, and that all profits from the Cares Pharmacy will be reinvested into client services, programs, and the community. The Cares Pharmacy is an independent, customer-focused, inclusive pharmacy specializing in HIV medications, treating the whole client for improved health outcomes. Our focus will be on our current client base of 2,500, who we already have an established and trusting relationship with. On average, 500 clients come to our offices each month for support. So adding the convenience of picking up their medications is a natural link. We interviewed our clients and 9 out of our 10 clients said that they would switch to the Cares Pharmacy. Since we have existing relationships with our target customer base, we have the unique opportunity to market the pharmacy at multiple existing contacts, our social media, newsletter, and word of mouth. So now let me share with you the financial data. It's very compelling. And let's take a look at Kayla as an example. The retail price for Kayla's HIV medication is $2,500 a month. As a 340B pharmacy, we can purchase medications at a discounted rate. So Kayla's medication would cost us $1,500, a profit of $1,000, which equates to $12,500 a year just for Kayla's medication. During our first year of operation, if just 5% of our 2,500 client base switched to the Cares Pharmacy, their medication alone would result in a gross profit of $1.5 million. As we continue to grow to 10%, our client base, we would see a gross profit of approximately $3.1 million, and so on. Our net income in the third year of operation is anticipated to be $2 million. I hope Kayla's story and the information that I've shared with you here today has you as excited as we are about this initiative, and you're asking yourself, how can I help? This initiative is more than just filling prescriptions. It's about providing comprehensive care to the HIV community and empowering individuals to live their best lives with dignity and respect. Your continued support is essential to Nashville Cares. You are well-respected members of this community and great ambassadors. Your expertise and connections will help us as we continue to build out our plans, and of course, your financial support will make this project a reality. Financially, we are asking for $500,000 in startup funding These funds will be used to build out the pharmacy space at our Thompson location here. We own the building, procure the initial medication funding, and for staffing and operating expenses. On behalf of the board of directors, the CARES family, and our clients, I sincerely thank you for your attention. If you want to learn more about the individuals that will benefit from this important initiative, please check our website or reach out to me. Thank you, and I look forward to your questions.
Okay, great. Thank you, Amna. And the first question goes to Harry Allen from Studio Bank. Harry, questions, feedback?
Yeah, great presentation. Very innovative idea, and I love the fact that it builds upon the current mission and the context that you have within the community. I do have a question on the startup costs. In terms of starting a pharmacy, what are the compliance costs, or what is the process for launching a pharmacy that's prescribing medicines?
So we went to pharmacy school, and right now we are actually having conversations with lawyers. It will be kind of an LLC, and we would need to make sure that we have a pharmacist that is staffed, 100% at the pharmacy with some pharmacy tech. And so really right now is building out the pharmacy at the location to make sure we have the specific specifications, and then looking at kind of the inventory. It's going to be a pharmacy that specializes in HIV medication, so most of it will be stocked. But we're really right now seeking legal advice and talking to pharmacists and making sure that we're in compliance and getting ready as we build out the pharmacy.
Okay, great. Thank you. Robert, you're up next. Questions, comments?
Well, first of all, echo Harry's sentiments. Great presentation. Just an amazing piece of work that you all are doing, and a service that you're providing. I had one question, and maybe just some clarification as you think about this product and this new service that you're providing. I wasn't quite as clear on the potential or the problem it is solving. My assumption is that it's around access to medication, but that didn't come through loud and clear in the presentation. It felt a little bit more like it's more of a convenience, an added convenience, rather than really solving a problem of access. So I wondered, and maybe I missed it, but if you could maybe elaborate on that a little bit, or talk a little bit more about kind of the specific problem that your pharmacy will solve.
Yeah, thank you for that question, Robert. So it is really about access and convenience. Since we provide comprehensive services here at Nashville Cares, and we just recently opened up a clinic last year in September, we have individuals that are accessing medical care. And just mentioning that there is, nearly 1,200 people that are not receiving HIV medical care, there's an issue of access. We also know that social determinants affect people from being able to access care, the stigma and the discrimination. So feeling that, folks are coming to us with other services here and already have built a trust with us, this will be an opportunity to come and pick up their medication. We can talk to them about the medication so that they understand what that means. To access medical services and also access the pharmacy. So the convenience of having it under one roof and kind of comprehensive services is really where we're trying to really support people and alleviate some of the access and barriers that people experience.
Great. I love that. The having everything under one roof is a concept. I would encourage you to maybe build that out a little bit, or focus on that in your fundraising pitches for sure. That's great. I'm having a little trouble, with your audio. It's kind of coming in and out. I don't know if that's just me or others as well.
Oh, I'm sorry. Can you hear me now?
Yeah.
Yeah. Okay.
Okay. Thank you, Robert.
Yeah, sure.
Next up is Jake. Jake, what questions or comments do you have for Amna?
Yes, Amna, thank you so much. It was really exciting to hear about how you're thinking of expanding your services to bring prescription medication and such to your customers, your clients, your patients. A thought that popped into my mind, and I'm not a healthcare expert, I know one of our panelists is, so hopefully they get to ask you some questions as well, was alternatives to solving the problem of access and compliance. Because in my personal life, I'm familiar with remote pharmacies or digital pharmacies where your provider can put in the prescription and it gets delivered to you. So you don't need to actually have all the infrastructure and on-site equipment, medications, et cetera, to be able to link your customers directly up with the medications that they need. I understand this population may be different or the medications may be limited, but that was just one thought to say, is there a more cost-effective way to offer the same benefit? I didn't know if you had pursued any other alternatives when you were thinking of providing the service.
So thanks, Jake, for that question. We're definitely looking at, mail order, but I definitely would love to research that and get more information about what that would look like. But usually our practitioners provide an e-script and then folks get the medication filled. There's a lot of discussion and conversation about medication adherence and, kind of really engaging with the client. That's really important with people living with HIV. And so really trying to make sure that not only are they coming to receive the medication, but the other supportive services and really supporting them to talk to a case manager and somebody that can really help them be successful with adherence and even, making sure that they're retained in care. There's a large number of folks that are not retained in care, so that's also a problem. So trying to look at really how do we support the person with all of the needs that they have and look at it comprehensively. But there is probably more cost-effective ways. I think the 340B, which is a program that we can get the medications not only purchased, we take those resources and put them back into programs so we can really help clients and alleviate all of the barriers and challenges that they're experiencing. So, but we will definitely explore that and look and see. I mean, we're working right now with a lot of experts. We're getting a lot of consultation to try to really understand what is the most cost-effective way and approach that we can, take on this initiative.
Oh, that makes a lot of sense. I'm sure there's benefits to having that higher touch model that you alluded to. But thanks for providing that clarity.
Thank you, Jake. Thank you, Jake. Chad, what questions or comments do you have?
Mine may be building a little bit off of Jake's as well, but I guess speak a little bit to competition. Certainly mail-in pharmacies may actually compete with some of what you do if your clientele are able to reach out to those kind of resources, but also are there other pharmacies that are nearby there or that might be competition as well that might be a barrier to kind of your entry into this as well?
Yeah, there's definitely competition, the box pharmacies and also some independent pharmacies that would be competition. I think what really, hopefully we can offer our patients is this comprehensive approach to service delivery and really coming in and being able to benefit and kind of focusing on the whole person. So we know that folks, can get medication anywhere, but there's also a way of how we can support them to address some of the other needs that they have and being able to kind of really help them be successful around adherence is going to be really important. So I think that's really where we saw that we had an opportunity to support our clients comprehensively and really focusing on the whole person. And really that social impact, I think, is really critical and important. That sets us apart from our competitors in that we're going to take these resources and put it back into the HIV community.
Great, thanks.
Thank you, Chad. And that leads us to Darshan.
Thank you. I'm going to echo the thoughts from all our other panelists. Very good presentation, and really appreciate you taking the time to walk us through what Nashville Cares does and the opportunity at hand. My question is perhaps a little bit different. It appears the opportunity here from a pharmacy perspective is pretty attractive based on the numbers you laid out. And it sounds like a big part of a treatment plan for a candidate who's dealing with this condition ends up being the cost of medication. But just maybe to piggyback off of the story you told about Kayla, and your goal of hitting about 5%, I think it was 125 individuals to get to some of those numbers. Help us understand how does Kayla find out about Nashville Cares, and how do you engage, whether the goal is 5% or eventually 10, 15%? How do you connect with that community? And is the pharmacy intended to be a mechanism to help people come in and get better treatment, or is it intended to drive a bigger addressable market in the community you're in?
So that's a great question. So first, Kayla knows about Nashville Cares. I mean, we promote our services, on social media. We also, a lot of other organizations, we've been in the community for 35 years, so we work with a lot of the health centers, the clinics, other nonprofit organizations, social service organizations, to really talk about, the services that we provide. So we, right now, through this testing initiative that we have during COVID, this was something that we really broadly, marketed and put out there on social media and other organizations. And so we have a lot of clients that come through and get testing. We test quite a considerable amount of folks each year for HIV. And then also we just, linkage to care, we have case managers, nearly about 40 case managers that work with clients. Since we see 2,600 people living with HIV each year, half of the people who are living with HIV in the metropolitan area, we've been providing case management for over, 2 decades, and really trying to help support clients. And then we also have our supportive services. So we kind of do a full wraparound of services to support clients. So a lot of clinics refer people who are living with HIV to us to receive case management services. During that time, we assess all areas of their life and do a comprehensive psychosocial assessment. And a lot of individuals we find are not adhering to their medication, not taking their medication. Also, when people are newly diagnosed, we have a program called the Early Intervention Services Program. So what we do, we have an intensive 9-month program where we work with people living with HIV to make sure that we help them navigate the health system so they're successful in accessing care and then being retained in care, and then also working with them on their medication. So really, we get different points of entry that people refer clients to us. And then really with this pharmacy, it's really about us being able to support our folks that are currently receiving services with us from a convenience, because they do come to us a lot, and that we have a lot of contact and engagement with them. So the goal is that if they come to us, we could be able to fill their prescriptions, talk about the adherence, and really support them, and be able to do this in one stop instead of them being able to go to different places. We know that transportation is a huge barrier. We cover 17 counties. So that's a huge barrier for folks to be able to access care and also receive, pharmacy visits, medication. Some of them take the bus for, hours on end. So we're just trying to make it more convenient, but then also how do we really support them to focus on kind of all of the services they need at one time, and be able to talk with them about what's going on in their life, including adhering to medication.
Yeah, that's very helpful. And I know we're running out of time here, but I applaud you all for what you're doing. For what it's worth, the approach you all are taking with the pharmacy side, with a very captive audience that comes in for care and counseling, is something I've seen a lot of other for-profit healthcare companies do, and do very successfully. So again, you all are going down a very, very interesting path, and wish you all the success.
I appreciate it. Thank you. And thank you so much for your question.
Thank you, Darshan, and thank you, Amna. And everybody, grab your emoji. It's time for a big round of applause for Amna Osman at Nashville Cares.
Thank you. I appreciate it.
Okay, and our next speaker is Will Kaplanor from Cumberland River Compact in Route Nashville. Sorry about that, Will. The floor is yours.
Thank you, Sean. Sorry, guys. All right. 3 million people and thousands of species depend on clean water from the Cumberland River. The Cumberland River Compact ensures that we have it through both on-the-ground work and education all throughout the watershed. My name is Will Kaplanor, and I'm representing the Compact on behalf of Mikhail Houghton, Meg Morgan, and Chandler Crisera. To have clean water, we need a strong urban canopy. Root Nashville is a citywide tree planting campaign led by the Compact. It's a public-private campaign to plant about 500,000 trees in Nashville by 2050. The campaign aims to increase the county's tree canopy and create a more equitable distribution of the health and sustainability benefits of trees all across communities in Nashville. It's more important than ever that we plant trees. We lose about 9,000 every year due to development and old age. We're going to lose 1.6 million to the invasive emerald ash borer. And we lost thousands in tornadoes and derecho storms. And this continues to increase as severe weather becomes more of the norm. We know trees are environmentally beneficial. They curb urban heat island issues. They provide stormwater benefits, provide habitat, and clean the air as well. So tree density in Nashville almost perfectly mirrors income disparity. The darker green or the more heavily treed areas tend to be the more affluent portions of Nashville. Unfortunately, through years of disparate policies, systematic racism, redlining, and other unjust symptoms and actions, our higher minority population neighborhoods tend to be the ones that suffer more. This can have much larger repercussions than simply inadequate shade. Let's now look at some environmental and health issues throughout Nashville. Unsurprisingly, many of the areas lacking tree cover are also experiencing many other threats. All of these problems could be greatly impacted by a more robust tree canopy. Luckily, many organizations and groups, ourselves included, now understand this and are working to right these historical wrongs. So if we look at this map, we can kind of see some of these areas in need, right? You can kind of look at some South Nashville areas, North Nashville, especially when you're looking at respiratory diseases, and then even kind of in the map. This can have much larger repercussions than simply inadequate shade. So we have observed that simply planting trees and walking away is not enough to ensure that the trees will survive. We have developed an affordable maintenance program to ensure that these trees survived into maturity, providing their benefits for many generations. This includes weekly waterings throughout the growing season, pest and pathogen protection, and pruning during the dormant season throughout the first 2 years of the tree's life. Over the course of 3 growing seasons, we have observed that trees with a care plan and regular waterings will survive at a rate of 90%. Compare that to about 65% without a care plan, and you can see the real benefit. This not only saves our clients money on replanting fees, but it also ensures that the trees are able to mature to a size and age where they really can begin to provide the impactful environmental benefits that they're capable of. So we are currently responsible for the care of 1,700 trees and are in our 3rd year of providing tree watering services. Through research, we have found that very few people provide this service. It's really just landscaping crews. And because watering falls in the same season as mowing, they price this watering service very high. We found that for them, tree watering really isn't a profitable business. Yet the demand for this watering service is very high, and it's ever growing as ourselves and other partners of the Root Nashville campaign continue to plant trees. So we offer rates starting at about 65 trees per season. This breaks down to $3.25 per tree per week. This beats our local competitors by about 33%. Tree care can be fickle due to unpredictable weather conditions, and it is a service that really isn't available for most folks in Nashville. And because this is so closely tied to our mission, we are invested in getting these trees cared for, and thus provide services and opportunities not really offered by others in the area. So we believe that a sustainably financed profit system would be perfect for a social enterprise campaign like we have created. Because we are a nonprofit, we can partner with the city to capture the campaign goals. Additionally, because we are grant funded and mission-based, we aren't beholden strictly to profit margins. This allows us to provide options and prices that would be unreasonable for a private contractor to do. This puts us in the perfect position to maintain a program that both sustains itself through typical client services and seed funding as well. Luckily, we are well positioned to grow. We're in our 3rd watering season, are experiencing healthy profit margins, and as long as we continue to grow our client list, we look to be able to maintain these profits or these margins well into the future. We envision a strong, healthy, resilient Nashville with a robust tree canopy. We envision a more just Nashville. There are myriad nonprofit organizations planting trees, but few care for these trees after planting. This is where we fit in. We are needing to expand our program through the purchase of another watering truck and trailer. We have recently maxed out our current cruise capacity and are looking to double our tree care numbers by adding another full-time watering truck and crew. Our ask is for help in expanding our fleet. To further our work in areas of need, we need $46,500 to fund the capital expenses needing to add an additional watering truck, trailer, tank, and watering supplies. With your investment, we can keep an additional 2,000 trees alive per year in our impact areas. This could create a more equitable Nashville, a more equitable and just Nashville, along with increasing our city's environmental resilience as well. Thank you, guys.
Okay, great. Thank you, Will.
Thank you.
Will. And for questions and comments, we're back to you, Harry.
Really fascinating presentation, Will. Thank you for that. I learned something. I didn't realize that to have clean water, there's a connection to the tree canopy. So I was really intrigued by that. I do have a question. You mentioned that, this is the third season and margins have been strong. What are the margins from this business?
Yeah, very good question. So as of right now, our margins are sitting around 60%. And as we forecast, this does drop a little bit, but it'll level out around 50% margins.
All right, thank you. Can I ask one more really quick question?
Absolutely.
On the truck, considered lease versus purchase, and how did you reach the ultimate decision, if you did consider a lease versus purchase, to purchase a truck?
We didn't consider leasing, honestly. We only consider purchasing. Maybe that's something we should consider. Maybe that could save us a bit.
Yeah. Thank you.
Yes.
Thank you, Harry. Okay. Next up, Robert. Feedback, questions?
Yeah. Hey, Will. Great presentation. Love what you're doing. I think my question is, and I may have missed it because Harry said this is something that he learned, but one of the things that may have been a little bit unclear to me, or maybe a little bit missing, was the connection of this project, the tree planting and tree care, et cetera, and how it advances the mission of the Cumberland River Basin or the Cumberland River Compact, your nonprofit and the mission of that. How does this project further that mission? Does that make sense what I'm asking?
Yes, it does. And so this, this was kind of the biggest kind of sticking point in creating the presentation. Was I felt like, I didn't want to put too much info in to kind of overload. But yeah, absolutely. So we are a water quality environmental nonprofit. And so planting trees and maintaining a robust canopy is the most monetarily is the most environmentally beneficial thing you can do in a city. So it immediately ties into our work, which is clean water, and in particular in Nashville, it's clean urban water. So we're running out of pervious surfaces, right? We have a lot of hard capped impervious surface area. We're right around 25% here in Nashville. So the depth of the roots of trees and just that capacity that they can add to a landscape can really make a big impact when it comes to stormwater absorption.
That's very helpful. And I would, as you go out and pitch this more, I would encourage you to make that, like, why us? Why are we the ones that should be doing this? And I think you just explained it really well, and would encourage you to add that in, or a little bit more focus on that. So for sure. So great. Good job. I love what you're doing. It's awesome.
Yeah, very good. Thank you, Robert.
Yeah.
Thanks, Robert. Next up, Jake. Comments, questions?
Yeah, I'll echo what Harry said. I definitely learned a lot from your presentation. Did not know enough about the income and wealth disparities in terms of tree canopy and how that connects to clean water. A thought I had, and a question, probably just a quick question up front, is $46,000 for the truck and the tank. But from a usage perspective, is it the city that would actually pay you to do another couple thousand trees, or how are you going to utilize that truck? Is the demand already locked in, or would you have to go pursue that?
Yeah, so we have both public and private contracts. We do have some contracts with the city, but currently what we're looking for are larger sites that aren't necessarily associated with the city. So yeah, we're basically hoping that with this truck we can then reach out to more clients, because we're at capacity at this point, so we can reach out to additional clients and kind of plug them in that way.
Got it. And are you over capacity at this point where there's a lot of inbounds, or is it more, you're smiling and nodding, so I'm assuming yes.
We found through the help of ICAT that we're riding right around capacity to over capacity.
Well, I don't mean in terms of, I mean in terms of, are you receiving more demand than you can service? Is there more incoming desire to?
Very good question. There's not 2,000 worth, right? There's not enough to completely fund the next fleet, but we have had to turn away a few people. Yes.
Gotcha. Yeah, I think that's just as a tip, kind of as Robert said, I think that could be something that could strengthen your presentation going forward. Is we know that this is the right path to take. This fits our mission, and we've already secured, I don't know, I'm making something up, a quarter of the capacity of this new truck, in contract, which would get us through the first 3 months. Whatever it is, but something to kind of show that this is not a, if I build it, they will come, but that there's, real demand side too.
I like the way that's framed. Yeah, that's a good point.
Thanks though. Great presentation.
Thank you, Jake. Thank you, Jake. That brings us to Chad. Chad, what kind of thoughts would you like to share on this? What questions do you have?
I'm somewhat just more interested and can't remember if you mentioned this or not, but from a standpoint of like manpower, does that investment also kind of cover or do the fees that y'all are being charged cover the manpower that goes into this? And does it take 1 or 2 people per truck, or kind of what is the level demand there? And also, I mean, it's also kind of generating jobs as well that people might get behind if they continue to, if you can continue to grow, it puts that many more people, that gives them opportunity as well.
Exactly. And that's our idea. We're hoping to eventually create kind of a green jobs program and be able to hire local people to help carry that out. But very good question. So a typical crew is 1 team leader. So the person driving the truck and the person responsible for all of the equipment. And then we have 2 waterers. This tends to be AmeriCorps Vistas that we have on staff. Sometimes it's other contractors that we've used in the past, but almost all crews will have 3 people in them. Yeah.
Okay, great. Thank you, Chad. And Darshan, questions, suggestions?
Yeah, no, thank you for the explanation and walk through. Good presentation. Well, I guess my question, and just in understanding something you said in your presentation about this project and investment, it appears that you should be able to take on another 2,000 trees. But just from an opportunity perspective, perhaps for the group, help us frame how dire of a problem is it? Absent the ability to go out and perhaps save another 2,000 trees, is there turnover in the tree population, and is it a function of just expansion, or is the watering element of what you are looking to raise for a big part of just survival for the trees out there?
Yeah, so basically, Nashville is a low tax environment, correct? We're all kind of aware of that. So the city was not able to care for planted trees, for current trees. So we kind of saw this niche that we needed to fill. It wasn't, when we created Root Nashville, this wasn't our goal, was to have a tree care program, but it became like this big, huge necessity. The city got to a point where they were not going to plant any more trees because they weren't being cared for. So that kind of is what opened that opportunity for us. Yeah.
Got it. No, that's very helpful, because it sounds like, and I think you said the first year, 2 years, up until they get to a certain size, it's the watering and the care for those trees. 2 years is an important part to the sustainability of that. And I think that's important context to maybe piggybacking off of what Jake and even what Robert said earlier as part of your presentation, helping people understand with the pace at which there's population growth in Nashville, to your executive summary, what does that mean for the number of trees in Nashville if nothing was done?
Okay.
I think that kind of a statistic can be pretty powerful in your presentation, particularly from an impact standpoint. And if it depletes 50 or 70% of the existing population of trees within a certain geographic area, I think that really drives home the point of the impact you guys are having from an organizational perspective. Congratulations, good work, and best of luck.
Thank you very much.
Okay, great job, Will. Round of applause. Everybody, use your emoji with abandon here. And that brings us now to Michelle Muldoon with Community Shares. Michelle, the floor is yours.
Gotta unmute myself. Hi, everyone. My name is Michelle Muldoon. I'm here representing Community Shares of Tennessee. Community Shares is dedicated to promoting a just and caring community by fostering a network of social change organizations in Tennessee. Historically, we've done that mostly via raising and distributing money to our over 30 member groups. But we know that we can increase the scope of this mission by providing some new services that address common problems faced by nonprofits, particularly very small and very new ones. So let's see what that looks like. This is Sandra. Sandra lives in a food desert, and she sees that her community's health is suffering from lack of access to fresh food. So Sandra is going to start up a nonprofit community garden. Sandra's organized, she's motivated, but she's inexperienced and she needs some help. For one, she needs access to money, but she doesn't know anything about writing grants. And that's too bad, because grant writing is a skill that not just everyone has, and weak grant applications tend to not get funded very often. But never fear, here comes Community Shares. Community Shares is a grant professional who actually boasts a 95% success rate, is going to research and write grants for Sandra. This is great news because she can know that her grants applications will be great quality, and therefore they're more likely to get funded. All right, so now Sandra has her grant applications in hand, but she's running into another problem. See, Sandra doesn't yet have her nonprofit tax exemption or her 501c3. And unfortunately, a lot of the foundations that she's asking for money require a 501c3 for funding. Also, since she's brand new to this, she doesn't have any sort of proven track record or history, and it's making funders a little bit nervous because they're not really sure if they can count on her to finish the work. So, no problem, because Sandra can take advantage of Community Shares' fiscal sponsorship services. So that allows an established agency with a 501c3, like Community Shares, to apply for and accept funds on behalf of another agency like Sandra's Garden. So the funds come to us, and then we administer them to the smaller agency. This is great because the funder can be assured that the grant funds will be used as intended, and that the agency that they're funding is stable. And in turn, smaller agencies can do better work and become stronger. All right, so now that Sandra has access to all this grant money, her garden has grown significantly. She teaches gardening classes to kids from all over the city, and she's even hired an employee. They've got donations rolling in, but Sandra doesn't really have the time or expertise to keep her books in good shape. So we know that keeping good books is vitally important for nonprofit maintenance and just general business practices. So Sandra is going to connect, or Community Shares is going to connect Sandra with a partner bookkeeping firm. Having a third-party bookkeeper takes enormous stress off of a small agency. It ensures that all of your financials are being kept correctly. It frees up a lot of additional time to complete mission work, and as it keeps your books and your employees separate, it protects against fraud. Now, we've conducted interviews with nonprofit leaders and done some online polling with nonprofit professionals, and they've all told us that these are services that would be helpful and that they need. In fact, we've already been successfully piloting the fiscal sponsorship services in East Tennessee, and Our current customers want to continue that relationship with us, as well as some foundations have expressed interest in referring new agencies to us in the future. Of course, we're not the only game in town helping nonprofits, but I assure you it's like apples and oranges. For instance, the Highlander Center in East Tennessee does fiscal sponsorship, but they're not seeking any more Tennessee agencies to sponsor. Alliance for Better Nonprofits provides training and consulting for nonprofits in East Tennessee, which is very similar to what Center for Nonprofit Management here in Middle Tennessee does. There isn't significant overlap in our potential customer bases because Community Shares serves a particular niche. Also, Center for Nonprofit Management is outside of our initial service area. And finally, we know that for-profit alternatives can't match our value because the little guy is our bread and butter. Community Shares' unique value proposition is that we are specialists in small and new nonprofits. Since 1985, Community Shares has been serving this particular corner of the market. So we know we can meet fledgling agencies where they are today and help them thrive at a price they can afford. Not only that, the revenue from this venture will allow us to better financially support our member groups, which means, in effect, dozens of agencies could see better outcomes based on this project. All right, guys, let's talk turkey. These are our revenue projections for the first 5 years of this venture. In year 1, we expect to just about break even. We'll start seeing a profit in year 2, which, as you can see, will increase over time with a net income of about $60,000 in year 5. Our initial expenses are very low as we don't need to take on any additional staff to start. As our business grows outside of what current staff can take care of, we're planning to supplement with contract labor, which of course means that our expenses will only increase as revenue increases as well. To get this off the ground, we are asking for $18,000 in capital investment to cover initial marketing and 6 months of expenses as we build our customer base. Let's check back out on Sandra. Thanks to Community Shares, Sandra's garden is thriving. In addition to those gardening classes that she was doing, she's making healthy and affordable lunches for her neighbors 3 days a week. The overall health of her community has improved significantly. This kind of success can happen in any community in Tennessee because stronger nonprofits mean stronger communities, and stronger communities mean a better Tennessee for everyone, including all of us watching here today. In a nutshell, Community Shares has been committed to improving the lives of Tennesseans for nearly 40 years. We can do so much more by providing these new services, but we need your help. Your investment of $18,000 puts you at the forefront of creating a more just and equitable Tennessee today. Thank you very much.
Great job, Michelle. I'd like to go back to the top of the order with Harry for first reaction and questions. Harry? Take it away.
Thank you. Thanks so much, Michelle. I can really appreciate the niche that you're serving as the smaller nonprofit and the startup nonprofit, people that have a heart for the mission but lack certain expertise and capacity. And first time being introduced to Community Share, so really appreciate the presentation. My question is around the whole fiscal sponsorship notion, and if you are serving as fiscal sponsor and they are awarded a grant,
yes,
where does the performance of the contract liability lie? Is that with the individual organization or is that with Community Shares?
So that is a great question. We as Community Shares would technically, the grant would be awarded to us. So that is the responsibility of us to make sure that that contract is being fulfilled. As part of this though, I mean, that's why we have to vet agencies for that. And it's why I mentioned that Sandra is really organized and motivated. That is a thing that you want to make sure that the agency that you're sponsoring is responsible for doing that. And assuming that they are, it actually requires really not that much work at all on our behalf, assuming that you're entering into a contract with an agency that is able to complete the work.
Yeah. Okay. And I guess those remedies could be outlined in your contract with the agency that's using you as fiscal sponsor.
Absolutely. Yes.
Thank you.
Okay, great. Thank you, Harry. Next up is Robert.
Hey, Michelle. So great presentation.
Well, I wanted to do this at work.
Great presentation. My question is oriented around I guess two questions, and maybe they're potentially related. One is kind of the opportunity out there. So is there any sort of analysis or kind of research out there that, like, how many new startup level nonprofits are out there in the market? And in doing that analysis, is that how you came up with your revenue projections? Like, when I saw the revenue projections, I was a little bit surprised by that and wondered how you got there.
So specifically, I don't have specific numbers on how much is out there. We do just know from our personal experience, having kind of been in the market for this long and knowing what we know about nonprofits. We know that there's a market for that, and we know that because we've seen it. I could find you more specific numbers about that. I don't want to stand up here and tell you that I have that in my head.
And I don't know if it's necessary. It just the thought came to my mind, and I wondered if it would be something that would help as you go out and seek funding.
And you know what, and you're probably right. And our projections, I think, came from sort of conservative estimates about these things.
Great. No, that's great. That's great.
Did you have a second question?
Well, it was related to the projection, so that I think you answered both of them there. And I know that's, it's hard to do that kind of analysis when probably nonprofits are starting up every day. There's such a huge need, and people have ideas and they want to get started, and there's no way to know how much of that is out there. So.
And that's sort of it. Is part of our sort of mission and our vision with community shares is that the people who are being affected by a problem are probably the best people to take care of it.
Right. Exactly.
And and so, but the people who are being affected by a problem maybe just don't have the business acumen or even know where to start. And bigger is not necessarily better. And we're hoping that we can meet that need where we're allowing people who want to do more hyper local things, who want to do stuff that is affecting them in their community, have the resources to do that.
That's great. Well, I think it's great work and important work, and I appreciate what you're doing for sure.
Thank you so much.
Yeah.
Okay, great. Thank you, Robert. And that brings us to Jake. Jake, your thoughts or questions?
Yeah, great presentation. Ton of energy, ton of passion, just really well rehearsed and such too. So it's fun doing that. This is a completely new space to me, but it makes sense that essentially there's really, really small nonprofits that can't access grant funding. You guys can be kind of a financial intermediary. And so the question about liability from the first panelist was one of my questions to understand what the risk was. It's interesting that you said you don't need more staff at first to basically test this out, it seems like, and break even. You just need a little bit of marketing to get going. What would be interesting from like a investment perspective, aside from that 18,000, is just how these nonprofits are currently getting funding. Like, what are their other options, and why is this their most attractive funding option? Because I would think these folks are probably getting a lot of just local friends and family donations or whatever that maybe are time consuming to gather, or they've tapped out for certain growth. But that would be kind of curious to me, is what are the alternatives at the lowest end of the market? You did a great job addressing your larger market competitors, but what are the options here?
Well, you're right. There's a lot of individual donations and things. As I'm sure you and we all know here, a lack of access to things like marketing is a big problem, and really sort of reduces the pool of potential influx of money. You got to spend money to make money, but if you don't have any money, that's a problem. Oh goodness, there was something I had a point that I was going to make.
That's okay, no worries. So it sounds like.
Oh no, it came to me. I'm so sorry. It came to me.
Don't worry.
Also, lack of 501c3 status means that donations to that agency aren't tax deductible, and so that's a big thing where the time and the upkeep that it takes to apply for that, get that status, maintain it, and things sometimes is just not worth it compared to sort of your relatively small stuff. Also, individual donations tend to kind of only go so far, and grant funding is really excellent because it's earmarked for specific projects. And so a small agency can kind of go in, get a grant fund, and know that they're able to see a specific project from start to end.
Got it. Do you offer any services to get these nonprofits 501c3 status so that they can raise on their own, or is that? Sorry.
That is something that is sort of on the docket for potential future offerings. We wanted to start a little bit narrow. We're rolling this out in East Tennessee, which is actually where Community Shares is headquartered. And then as that gains steam, moving into Middle Tennessee and then finally West Tennessee. We started with these particular offerings because they're pretty low risk for us.
Yeah.
To be able to get good footing on that. But things like nonprofit compliance are on the future list, as well as donor management. So.
Got it. Awesome. I think this is a really interesting idea. So no further questions from me. I was just curious kind of the background on the industry. Thanks for sharing.
Okay, great. Thank you, Jake. We've got time, I think, for one more question. So Chad, this passes to you.
Yeah, first of all, great presentation. Having worked with a lot of nonprofits and sat on a couple of boards, especially a smaller nonprofit board, I've seen how grant funding can really help, and also how limited resources and time of a smaller nonprofit really prevent those organizations from really going out and seeking those. So I think it's a great niche there that can be served, especially those who don't have a C&M in their backyard, who you may be addressing as well. And also from the other standpoint, from that fiscal sponsor, I think it's a great idea. While we all love nonprofits and want a bigger community of those, sometimes you don't need another nonprofit, just for maybe a specific project or something that someone really wants to do and is passionate about. And that certainly is a good way to be able to kind of pool those projects and passions under one one entity, and reducing the cost that goes into 5 different entities forming a new nonprofit and all the costs that go into that. So I think it's a great niche market there. Just one quick question was just from a staffing standpoint, and it's kind of maybe jumping off of an earlier question, but do y'all plan to do all that internally, or using contractors maybe to serve those to also kind of reduce your overhead and only have to service those or engage those contractors when needed, or kind of how do y'all plan to do that?
We have our staff people who can take care of the grant writing and the fiscal sponsorship piece. They obviously also have limited time, and so at some point, theoretically, our cup runneth over, at which point we'll turn to contract labor that can be brought in on kind of a one-off basis. So that way we know that we're only incurring additional expenses as our revenue increases. As for the bookkeeping portion, that will be administered by a partnering bookkeeping firm because we just don't have the capacity to do that. But it is equally important. So
thanks.
Okay, great. Thank you, Chad. Thank you, Michelle. And now we're going to take a brief break so that everybody can either go load up on some coffee or get rid of some. And we'll come back in just 7 minutes. Matt's going to set the timer and start that. And when we come back, we'll be hearing from Gail Powell at High Hopes. And Darshan, you'll be first up on the Q&A.
Sounds
So we'll see you in
good.
a few minutes.
Thank you.
Thank you. And we're back. We'll wait maybe just another moment or two to make sure that everybody's returned. And Brandy, if you'd like to go ahead and start sharing the slide deck. Okay, so okay. Jake and Robert, if you're back, please come on camera. All right. I think we've got everybody back that we need, and so thank you all for coming back. Our next speaker, please join me in welcoming Gail Powell from High Hopes. Gail, the floor is yours.
Thank you. With a 36-year proven track record for intervening for families who have children with special needs, High Hopes is poised and aware that it is time to take our mission outside our walls. We are not establishing new programs, but simply taking our 36 years of excellence outside our walls. After our humble beginnings in the basement of a church, High Hopes was blessed in 2014 with our forever home, and due to community growth, expanded in 2018. Today, also because of community growth, we find ourselves with those consistent wait lists once again. Our mission statement is carried out in this building by 75 staff members, providing therapy, education, and most of all, loving support, changing young lives every day. Our mission is delivered in two ways: a pediatric therapy clinic, our healthcare side, and an inclusive school. The clinic serves children from birth to 21 years, all with a diagnosed special need, with physical, occupational, speech, and feeding therapies. In order to help you understand just how important these therapies are, join me for the story of Joey, who lives with his grandparents in Williamson County. He came to us at 9 months old with orthopedic challenges on all 4 extremities. Now, age 5, he's had these therapies for several years, and he no longer needs feeding and speech, but his quality of life continues to improve through physical and occupational therapy. In addition to the clinic, High Hopes also has a school with 11 preschool classrooms and 1 kindergarten. Our unique school model of 60% children who are typically developing and 40% children with special needs is wonderful so that all of these children can learn and grow together. Joey is a big hit with his friends in his classroom. He's learned a lot from his typical peers, but they've also learned a lot from him. And like all of our school students, Joey is able to get his therapies during the school day. Because of his academic and orthopedic progress throughout the years, Joey is currently 5 and enrolled in our kindergarten class as a typically developing child. As part of the Innovation Catalyst strategic realignment process, High Hopes set 2 goals, one related to mission and one related to money or financials. Our mission goal was to serve an additional 300 children like Joey. The strategic money goal was to have 1 million in reserves by 2024, thus propelling this 36-year-old mission into a strong financial place. Taking the mission outside our current walls will definitely help make both goals a reality. Does High Hopes need to expand? What does the data tell us? We have consistent wait lists. What if Joey was still waiting, or your child? The greater Nashville region shown here continues to grow by 81 people per day, moving to the area. The Davidson County Chamber states that 25% of this 81 is in that population, of this population is in the 0 to 19 age range, which is very similar to our clinic. So that is approximately 20 per day moving to this area in that age range. The US Census tells us that 1 in 5 have a disability. So this means that 4 children a day with disabilities in this age range could be moving here every day, not to mention the children who already live here. Of the 20 counties that High Hopes currently serves, Davidson County has consistently been number 2 in the number of children served, number 2 to Williamson County, where we are located. Because of a strong relationship with the private school, Lipscomb Academy, High Hopes is in final negotiations to partner our brand with this school to serve their students and to serve outpatients in the Davidson County community beginning August 2021. This satellite allows children like Joey to be served closer to their homes and their schools, thus creating a better quality of life for them. Lipscomb has a brand new facility, Solly School, built to serve children with special needs who attend their classrooms. The plan is for High Hopes to open a therapy clinic in Solly School, creating a satellite clinic that is simply a miniature version of the clinic that we currently have at High Hopes, serving children in a school and serving children from the community that we call outpatients. Lipscomb is in the process of enrolling 10 students with special needs who will be included into their program, into their elementary school next year. And High Hopes forecasts an additional 40 students from the Davidson County who do not attend the school, and we call those patients from the community outpatients. In years 2 and 3, we would have 20 school patients and 60 outpatients. Our financials for the satellites reflected here are extremely conservative, higher on expenses and lower on revenues. By the second year, the revenues and expenses are the same, and by the third year, solidly in the black. As you can see from years 4 and 5, this satellite is a sustainable, mission-focused venture. The satellite clinic at Lipscomb is a first for High Hopes. With extremely low risk, has the capability to bring in financial reserves and posture us for future satellites to continue taking the mission beyond our walls. So more children like Joey will be ahead and more lives changed forever. Today, you've heard one story, Joey, of our current 1,000 stories. As we seek investors for this endeavor, we're encouraged by the promise of expanding our brand, serving more children, and creating additional reserves for the overall health of the organization. High Hopes will need $225,000 for the first year expenses and cash reserves to backstop this expansion. As new therapists and support staff are added and insurance reimbursements require time for receipt, cash reserves are critical. We would like for you to be part of our story, part of the story of our children, with an opportunity that is so important and so unique to Middle Tennessee as we partner with a private school and provide children other choices for their education.
All right, thank you, Gab. Pardon me, Darshan, questions, feedback, thoughts?
Absolutely. Well, first and foremost, Gail, congratulations on the work you all have done over several decades. It's clearly a testament to the success you've had when you were able to continue to be able to expand the program that you've been offering thus far into new counties like Davidson County. So thank you for everything you all do. My question is, well, I had a few, but maybe I'll limit myself. So some of my colleagues and partners here can also weigh in. But my question is around the partnership with Lipscomb. First and foremost, just genius, in my opinion, to partner with the private sector and take advantage of some of their resources to really bring your mission to a broader world. Help us understand how that's come about, and how do you envision replicating that approach in other counties? Because the way you laid out the opportunity set was actually very well done and very clear. I'm very interested in understanding, was this a problem you brought to Lipscomb and then identified them, or vice versa? And then how do you envision that over time sort of replicating in other counties across the state?
Well, as Lipscomb has the opportunity because of a donor that made this building possible for them to start, including children into their school, they really wanted to have an excellent special education program for them. And so we began discussions actually probably a year and a half, 2 years ago, and it just sort of happened. This opportunity just seemed like a really, really good fit and a need that they have so that their children too can get excellent therapy services during their school day. And that then they're allowing us also to see other Davidson County children who also need therapy closer to their homes. So it just was a natural fit, and we're so excited to be a part of this. It is very unique that a private school would include these children with special needs into their classrooms. So we're just thrilled to be a part of it.
Fantastic. And then maybe if I can slip in one more quick question. The service you offer and the education services are pretty important. Are most of them typically delivered within a facility, or does your organization also provide some of these services sort of in a home setting for members of the community?
I see your question. Really, the only in-home we do is for children birth to 3 years old. We are a provider or a vendor for the state of Tennessee for Tennessee Early Intervention System. So we can see children in the home who are under 3.
Got it. Very helpful. Thank you and congratulations.
Thank you.
Okay, great. Thank you, Darshan. Harry, you're up next. What are your thoughts or questions here?
Yeah, awesome job, Gail. Good to see you. Congratulations on the opportunity with Lipscomb. My question is a fundraising question. In my experience on boards and in the nonprofit sector, it can be difficult sometimes to fundraise for reserves. Is the target investor for that component different than the overall? Donors and investors get really excited about supporting the program and less so reserves. So just wondering your thoughts there.
Well, our thought is that there really might be some people excited about helping us relocate. And I think one thing we have really learned in the last year is that it's good to be proactive and have those reserves for programs. And we think this is so important. We just really want to reach out and get that help so that it can continue going. Again, we're thrilled.
That's awesome. And I do understand that you have to staff up before
yes.
the program is actually, so you may even want to call it a working capital reserve or something.
It is a working capital reserve. Yes,
so using that language sends a different message.
It does. You're absolutely right, Harry, because we'll be hiring therapists and support staff who will be working with these children. Then we bill insurance, and we also bill the state, the birth to 3 program I mentioned, and it takes a little while to be reimbursed. We all know that. So yes.
Great job. Congratulations.
Thank you.
Thank you, Harry. Robert, what thoughts or questions do you have?
Yeah, thanks, Sean. Gail, great job. Loved your presentation. Especially loved just telling some stories about the children that you all serve. I think bringing that adds an emotional component to it that is very helpful. So thank you and awesome work. My question kind of related to an earlier question, Darshan's, about the partnership with Lipscomb. First of all, I think that's obviously a great avenue to take in expanding your services is to bring a partner along with you. And I think anytime you develop a partnership like that, there are complexities to it. There are potential risks associated with it. And perhaps something that a funder might be interested in is some narrative around how you plan to navigate those risks, or kind of contemplate those risks and how you navigate those. So maybe a couple of comments about that.
Yes, that is something we've been in a lot of communication about with Lipscomb, and we're reaching an agreement, and we'll start with a first year agreement, but we know we'll both be learning as we go, and that, you know, after the first year there may be different things we need to talk about, but we feel like both of us really have that end in mind, which is the child, and both of us, that has been our goal for years and years, them even longer than us. And so, but we do know that, and that's part of our startup cost, frankly, is the legal. So yeah, we're looking into all of that.
Great. Awesome. Well, loved your presentation. Thank you.
Thank you.
Thank you, Robert. Jake, what questions do you have?
Yeah, I'll just echo the sentiment. Super exciting way to expand beyond your core geographic base with a partner like Lipscomb, for sure. I had the similar thoughts to Harry in terms of working capital. So I have two little questions. The first one, as it relates, is you know, the financials you showed made a lot of sense, and it's more of a break-even type of enterprise. For an investor to cover those upfront expenses that seem to always be needed on an ongoing basis, how would that investor get repaid? Or is the idea that it would be more of a grant to High Hopes?
That's a great question, and it would be more of a grant to High Hope. Okay. And then it really is the working capital reserves to help us get going that first year. And then it would just be in reserves again so that we can continue this program.
Yeah, I think I don't know enough about funding working capital nonprofits whatsoever. But one thing that I would hypothesize is maybe after a year or two of consistent operations, the investor would be able to get repaid because maybe some sort of financial institution could step in if the operation was that consistent.
That is a good thing. But my thought is that would not happen. That would happen. It would be a grant. And it
got it. That shows my naivete.
It would help this organization because part of what we're doing here is coming up with ways that we can sustain the mothership, you know, of this organization. So our thought is that it would be more of a grant. Yes.
Totally makes sense. Last question then, and I may have missed this. I apologize if I did. You showed the number of children that would be served by this opportunity. I wondered in my head how that related to your core services. I'm sure I could Google it and find it on your website, but how much of an expansion in terms of children served would you provide?
Well, we currently are serving a total of 1,000 kids, and that is our school and our clinic. Yep. So this is, like I said, it's a miniature version of our clinic. Our clinic currently serves 800 kids from about 20 counties. Davidson County, again, number 2. So honestly, we know one of the greatest challenges our first and second year will probably be keeping it small because again, this community is exploding. And if 1 in 5 has a disability, we even in the midst of, we hope at the end of the pandemic, we are still serving so many children and have wait lists. It doesn't go away just because of the other pandemic.
Totally. Thanks for sharing that.
Thank you.
Okay, great. Well, Gail, thank you very much. Great job. Once again, a big round of applause for Gail, or a big round of emoji, and nicely done. And this brings us to our final pitch of the night. I will remind you all, please hang around for a little while after what seems to be the end of the program. We are hoping to shoot 1 or 2 group photos. But without further ado, I'd like to welcome Rebecca Ratz from Friends of Shelby Park and Bottoms. Rebecca?
Pull this up here. There we go. All right. Parks connect us with nature. They keep us healthy and they're vital to the economy of our city. And in a time when distrust is high and we are increasingly living in insulated lives, parks bring people together. Good afternoon. My name is Rebecca Rotz, and I'm the Executive Director for the Friends of Shelby Park and Bottoms. We're the nonprofit partner to the City of Nashville Parks Department. And I'm lucky to work every day to make this park a great place for Nashvillians. So Shelby Park is a 1,300-acre park bordered by the Cumberland River, 2 miles from downtown and in the heart of East Nashville. It's a vibrant park with a wealth of activities, including 16 miles of trails, a community center, nature center, golf courses, playgrounds, ball fields, you name it, and a diverse group of users that you'll find nowhere else in our city. And at the western entrance of the park stands a building that's unlike any other. Built in 1948, the Naval Reserve Training Facility was designed by noted architect Edwin Keeble of L&C Tower fame to resemble the prow of a ship. It was an active training center until 2009, when the Naval building was decommissioned and transferred to the Parks Department. Since that time, the building has sat empty and neglected, and this historic treasure has become an eyesore in the park, and without timely intervention, it could be lost to disrepair. But it doesn't have to be. This 17,000 square foot building, perched on the edge of the Cumberland River, is poised to be one of the most amazing assets that the park has to offer. Welcome to the Shelby Naval Commons, a community hub that brings neighbors together to connect with the park and with each other. At the heart of the Commons will be a large events hall overlooking the river that will host beautiful weddings and community events alike. Along the wings will be flexible office space for nonprofits and neighborhood businesses. At the west end of the building, we envision a restaurant and market that invites neighbors to share a meal or to grab a picnic before heading into the park. On the ground floor, accessible from the regional greenway, is a space for recreation-focused retail, bike or boat rental and tours that open access to the larger park. Now, our market research and recent park user survey indicate an unmet demand for food service in the park, for affordable community event space, and for move-in ready small office space. The best way to bring this building to life is with a public-private partnership. It is our goal to develop a long-term lease agreement with the city, allowing Friends of Shelby to lead the redevelopment and oversee operations and maintenance in the building. Friends of Shelby is the right partner because of our mission alignment with the City Parks Department, because we have the trust of our neighbors to work for their benefit, and because we have the flexibility of a non-governmental organization to bring private funding and investment to the project. To do this work, we have brought together an amazing team of experts, including designers, developers, financial experts, and community members. And throughout the Catalyst program, our team has been advised by representatives from the City Parks Department and the Mayor's Office. With the expertise of this team, we have developed a working pro forma with preliminary construction estimates totaling $6.7 million. This includes architecture and engineering design, site and building improvements, tenant build out and lease up. To fund the redevelopment, our model includes $2.5 million in capital contributions from the public, foundation and corporate sponsorships, and city support, with $4.2 million financed by the Friends of Shelby through mission-driven lenders. The project will take 3 to 5 years to work through city approvals, funding, design, and construction. After opening, we project 6 months to stabilize occupancy, at which point we would expect annual positive cash flow over $100,000 that can be reinvested back into the park. That adds up to over $500,000 over 5 years invested in park maintenance, improvements, and programming. In addition to creating a much needed revenue source for the park, our project will preserve an endangered historic landmark for public use. It will increase the use of the park by all Nashvillians, and it will create a place for people of all incomes and backgrounds to discover opportunities for shared experiences. With a nearly even split in Black and white population and a wide distribution of education levels and incomes for the 37,000 households within 3 miles of the park, our objective is for the project to provide amenities that are welcoming and accessible to our diverse community. As Nashville continues to grow and East Nashville continues to gentrify, the park is the place where all members of our community can come together on equal ground, where long-term and new residents can build community together. Parks have the power to connect people, and that is the goal of the Shelby Naval Commons. Friends of Shelby is the right leader for this project because of our mission focus. We are not a for-profit developer. We are working on behalf of our community. And we will curate a group of partners and tenants who share our goal to support and engage the community. In order to move the project to the next level, we are seeking $280,000 to move forward with more detailed architectural design and engineering studies to complete immediate cleanup and remediation needs, as well as testing. We are very excited to be meeting later this month with the mayor's office to share our completed business plan and talk about next steps with the city. So please join us in enhancing our park and creating a place that brings neighbors together. Thank you for your time and attention, and I'm happy to answer any questions.
Thank you, Rebecca. And I think our first question then goes to Chad.
Great, thanks. Great presentation. And I think before I saw this presentation, this was, even as a native Nashvilleian, I never knew that facility was there. So it's nice to be educated even on that. I guess one of the questions I had, obviously, given some need and or lack of need currently for meeting space or office space and the kind of uncertainty maybe that lies with what comes forward. Have y'all kind of evaluated who is your competition that you would be competing with for tenants for that kind of space? And what would be maybe your competitive advantage to get them in there versus maybe somewhere nearby or elsewhere?
Sure. We've done a lot of investigations into sort of the current status of space, specifically in East Nashville. And there's a number of spaces that are available. What we're showing the market trending toward is those smaller spaces, especially where you can get a smaller office and then share amenities with other groups. Sort of like a WeWork, but maybe not to the extent where we're supplying coffee for everybody on a regular basis. But there are some sorts of shared amenities. And we've heard from folks who are in the leasing field that there's a high demand for that. We've also just seen from the amount of response we've gotten since we sort of kicked off this process, the numbers of calls that we've gotten from folks who say, well, when's this going to happen? When can we, how much space do you have and when can we move in? So we've actually gotten a lot of interest already. That's been very exciting. The other thing I'll add is, I talked about curating our tenants and making sure we have partners who are aligned with us. In our current pro forma, we have outlined a reduced rate rent for, I can't remember off the top of my head, I want to say it's 40% of the office space that would be actually at a reduced rate so that we could attract nonprofits, small startup businesses who we really believe in and want to have in the space, but maybe can't afford the full market.
Great, thanks.
Great, thank you, Chad. Darshan, questions?
Absolutely. Well, congratulations, Rebecca, for what you all are doing here. This is a pretty gargantuan undertaking from what you've walked us through. And so thank you for taking the time. I guess my question specifically is in and around what you all have done. So Friends of Shelby Park, can you help us just understand perhaps some of the other projects you perhaps have undertaken? I think the exec summary listed out a pretty high-powered board of folks that are going to be working with you on this project, which it sounds like you guys are well down the path of, and you've got all the right experts. But just how does this compare to similar initiatives you might have undertaken in the past? My firm invests in companies, and this feels like, literally building a company, just with the amount of different parties that are coming together. So pretty impressive stuff. Would just love to understand what projects and initiatives you guys have done that are similar in nature.
Yeah, I'll be upfront and say that there is nothing similar that we have undertaken, that meets this level. For the past 12 years, Friends of Shelby has been a all volunteer board. And then over the past now 16 months to 18 months, we have one staff person, and that would be me. So this is a huge step forward for us. Now, we have definitely made investments in the park. We've had, I wouldn't say anything that amounts to a capital campaign, but we have, invested in playgrounds and trails and things like that in the park. Nothing to this level with a building, but we do really feel like the team that we have is a strong team that is, and we're going to do this incrementally and step by step and make sure that we have that lined up, that we have a business model, that we are not, that our volunteer board is not taking this on, that we have the staff in place to do this. And so that's sort of part of the model as we work forward to take something on like this. And we really hope that the city is going to be a big partner for us in this, because it's city property. It's not Friends of Shelby property. This belongs to the community, and we need to be in this together. And so we also hope then they provide some stability and foundation for what we're about to take on.
Yeah, that's fantastic. And congratulations again on pulling together such a strong group of individuals and some of the success that you appear to have already had on the capital contribution side. And best of luck.
Great. Thank you, Darshan. Harry, what are your thoughts?
I have a lot of thoughts, but as Darshan said, Rebecca is such a bold vision, and I'm a Nashville native as well, Chad, and just appreciate offering the city a community asset where folks can come together in a really gentrified and diverse community. So fantastic job on the vision. It's definitely compelling and exciting. So a couple of well, I guess I only have one question I can ask, but I'm really curious on the pro forma, if you built in any line items for a maintenance reserve, or what is the insurance cost and utilities. There's a lot of occupancy costs that go into a project of this scale, and so if you could help me with that a little bit.
Absolutely. And I don't know if Mary actually wants to come on. We can send out all of those numbers, but absolutely. Given the wonderful team that we have some development professionals on our team, and we are accounting for all of that. For the reserve, we understand that 5 years out, we're going to have to renew leases, and we understand that we are going to have to replace the HVAC system. So we have definitely considered that, and I'd be happy to share with you so that you can see that we have really thought through that process.
Yeah, thank you. And if I have time to ask a second question after the other panelists, I'd love to ask one more question.
Okay. Well, Harry, why don't you go ahead with that question?
Yeah, great. Okay, so I think approaching the city is a fantastic idea, especially given that it is on city property and a community asset. 62% or 4.24, it says, will be financed through mission-driven lenders. Are those nonprofit community financial institutions or traditional commercial banks? Where's the financing piece coming from? And is collateral a consideration, since the land the building sits on will be owned by the city?
So we've talked to a couple folks who are sort of in this non-traditional lending environment, and we have some different ideas about groups that that finance capital projects for nonprofits, Partners for a Common Good, Community Reinvestment Fund. You know, so obviously the more capital money we raise, the less we have to finance. We think we've put out a pretty conservative model with the 2.5 being raised in capital and then financing the remainder. But we do think that there are lenders out there that will want to invest in a project like this. So we've had some of those conversations, and that's sort of one of the next steps, right? To really explore that further once we have a little bit better understanding from the city on their commitments.
Thank you.
Yeah.
Great, thank you, Harry. And Robert, do you have any questions?
So I'll be honest, my questions have been asked, although I have one that's just based on curiosity. I noticed in some of the pictures, the building sits very close to the river's edge. And given recent events of last week and flooding, like how, like, are there additional kind of construction build out requirements to protect that building from flood damage? And I know it's kind of a weird question, but it's just
that's
curious.
Totally relevant question.
Yeah.
So this past week there wasn't any flooding in the building, and in 2010, during the flood of 2010, there was a few feet of water in the basement level. So that level I talked about with the active recreation retail component, most of the building is elevated and did not flood in 2010. That active recreation level, our intention is, number one, we also have a very low lease rate on that space, because we understand that that's going to be a risk of that space. And we also understand that the finishes there are going to be concrete, and you're going to be able to get in there with a hose, and that it will flood every 100 years, right?
Right.
but that we will design it so that is, that can happen, and that hopefully we can see that coming and get the bikes upstairs before that happens. Yeah.
Very good. Thanks. That's exciting. It's fun to think about that resource being available for the city. So.
Okay, great. Well, we are. Thank you, Robert. Thank you, Rebecca. Great job. We are rapidly coming up on time for voting on the People's Choice Award. And Terry, I'd like to hand the proverbial mic over to you.
All right, let's see if I can get my unmute and get my camera on this time. Wow, this was a wonderful and impressive slate of impact teams. I'm just blown away by what you guys have done, even since the midterm. Really, really exciting. Now, watch your email, guys, because the voting is open. So we're going to be open for 3 minutes. Is it open yet, Sean?
It is open.
Okay. All right. Because you're going to have to listen to me talk for 3 minutes, I'm afraid. I don't have 3 minutes worth of remarks, so I'll be extemporaneously speaking in a minute. But really, congratulations to all 5 teams for completing a fast-paced and intense program and taking a really deep dive into your organization. I know Sean and his team don't let you get away with, let's do a show. You've got to make your case, and I can tell that you've worked hard, really hard. And we celebrate the work of your staff, your board, and your volunteers that contributed to your successes, because I know it's not just the people that spoke, it's a whole team of people that worked on this. And that's what's really fun also, I think, about this ICAT process. So I'll remind you to vote. It's open. Check your email. And if you made a donation to the People's Choice Award, you'll be getting an email about how to cast your vote. I'll start off with some thank yous. Again, thanks so much to Marcus Whitney for kicking us off and getting us revved up. The sponsors that make this an affordable program to participate in include the Frist Foundation, LBMC, Google Fiber, and Alliance Bernstein. And oh my gosh, our panelists were amazing. You guys asked the best questions. We had Harry Allen from Studio Bank, Robert Avenger from Alliance Bernstein, Jake Martino from Bridgestone, Chad Millam from LBMC, Darshan Prabhu from Star Investment Holdings. And I just want to take a minute to say that both Harry and Darshan are on the CNM board of directors, and they serve on that board. And we are so glad to see them in action. And thank you especially for taking time on that. Our impact teams: Community Shares Tennessee, Friends of Shelby Park and Bottoms, High Hopes, Nashville Cares, and Root Nashville. What a wide variety of different types of organizations and really creative ways of moving forward and serving the mission. And of course, our CauseImpact team, who guided the group. Sean, Joy, Tom, and Matt, thank you so much, and for taking such great care in this complex virtual event that we had. We haven't done it like this before, and so it's terrific. And then I have to say, the CNM staff really came out and made this event work and have done a lot of work. So I want to especially thank Kyla Phillips, Megan O'Rourke, Marissa Sweiston, Hillary Music, and Catherine Swanton. And also everybody who donated to the People's Choice Award. That was just something new and fun that we thought would be an interesting thing to try. And so we're real interested to see who comes out on top. I think everybody's a winner. Everybody's a winner. I'm watching my. I'm going to get notified when we've got the winner. And I want to thank the attendees for tonight's events for coming and supporting the impact teams, whether you're board members or staff members or proud family members of those that were presenting. A lot of work went into this whole process. I mean, again, it was a 7-month process, which is truncated a little bit from our usual 9 months. But it's a real commitment, and it takes a really a dedicated group to take an idea and develop it and make a business plan. And so we are excited about that. How much time is left, folks, on our voting? I didn't get to vote yet.
Well, you should definitely do that, Terry.
I do. I need to vote. Except for I can't pick. I like all the.
We're in our last 30 seconds of voting.
30 seconds. Okay. All right. Well, there's dead air here. Sean, do you have anything you want to add at this moment while we're voting?
Well, it's been an honor and a privilege to work with all of these great teams. You know, I've got the greatest job in the world, because I get to work elbow to elbow with all of these great people who are focused on such incredibly important missions, and I'm always on the steep part of the learning curve. You know, so some of you have heard me say this before. Ignorance is my superpower. You know, so I'm always eager to learn more, and I get to do that with all of these great people. It's been an amazing journey, and really our journey together isn't over. When you work this closely with people for this long, you build personal relationships, and I expect those personal relationships to carry on long after the projects are finished. And I look forward to that, and I look forward to seeing what you all actually bring to life on the backs of this work and this planning. I have a little bit more to share, but I think we might be at the end of our voting time.
We are. Oh my goodness. And we have a winner. So drum roll. The winner is Community Shares, and they have won $1,360. Congratulations, Michelle. Bravo. Bravo.
Congratulations, Michelle.
Well, I think that everybody did a great job and everybody's the winner because you have a solid plan that you're ready to implement, and we are excited to watch what happens next. We have, as Joy shared earlier in the evening, we have some really great success stories of folks that have gone through this program and really implemented. Michelle, do you want to have an acceptance speech real quick before we go?
I didn't even know I was nominated. No, this has been such an incredible experience. It's been wonderful to just kind of get to know everyone and to really learn how to think about doing things in a little bit of a different way. And I think it has really changed my mindset about how to get things done. And I am just looking forward to seeing how we all take these projects and turn them into reality. Thank you so much for voting for us. I can't believe it.
That's terrific. Congratulations. Again, thanks to everybody who participated and made this event possible, and for everybody who attended. Really excited to see what happens next. So have a great evening, everybody.
Terry, we're not quite finished yet.
Oh, we're not.
But wait, there's more.
But wait, now wait. Let me read my last sentence. Let's hear from Sean McGee again about our next cohort. Sorry about that.
Oh, no, it's all good. So congratulations to Community Shares. Fantastic job. And congratulations to all of you. Every team represented here tonight has worked hard to develop their ideas, and I could not be more proud to have worked with each and every one of you. Amna, Will, Michelle, Gail, Rebecca, it's been wonderful. You guys have put together awesome teams. You've done great work. I'm really looking forward to seeing it all become a reality. And you've shared some great ideas tonight, and the initiatives we've heard will enhance healthcare outcomes for disadvantaged community members. They'll improve the environment in Middle Tennessee. They'll amplify the voices and impact of nonprofit organizations throughout the state. They'll improve access to state-of-the-art therapy and educational services for children in our community that have special needs. And they'll create a new community hub in East Nashville to better connect neighbors with each other and with a beautiful green space along the Cumberland River. Now, I'm really proud to be a part of the teams that brought those ideas to life. And I've been blessed to work through Innovation Catalyst with literally dozens of innovative nonprofits in Middle Tennessee over the last several years. And as much as we've all accomplished, we're really just getting started. There is so much more opportunity ahead of us. So I want to ask, does your organization need more resources to support its mission? Do you have ideas for better ways to serve your people, your community, and your mission? Would you like to have the opportunity to pitch the next great idea? If the answer is yes, I've got great news for you. Tonight, I'm excited to announce the 2021 Innovation Catalyst cohort. Applications open on June 7th. We have 2 information sessions on the calendar, one on June 9th and the other on June 24th. You can register tonight at the link that Tom is posting in the comments on YouTube. Join us at one of these sessions to see if you're a good fit for Innovation Catalyst. You'll hear from some of our funders and some of our past participants and learn more about the process and the competitive application process. I really hope to see you all in June. Thanks for joining us this evening. And I hope that all of the great presentations we've seen tonight will inspire your thinking about the next great thing that's going to happen in Middle Tennessee. Thanks so much.